Let's talk about vaginal atrophy. Also known as atrophic vaginitis, it's a condition characterized by the thinning, drying, and inflammation of the vaginal walls. It typically occurs as a result of reduced estrogen levels, commonly experienced during menopause. Vaginal atrophy can cause a range of symptoms including vaginal dryness, itching, burning, and pains during sexual intercourse. Vaginal atrophy primarily occurs due to a decrease in estrogen levels, which can happen during menopause. It's important to know that as women approach and go through menopause, their estrogen levels naturally decline, leading to changes in the vaginal tissue. Surgical removal of both ovaries, which is called the bilateral oophorectomy, can also cause an abrupt decline in estrogen levels, resulting in vaginal atrophy. Estrogen levels can be lower during breastfeeding, leading to vaginal dryness and atrophy. Vaginal atrophy can cause a variety of symptoms, which may vary in severity amongst individuals. Common symptoms may include vaginal dryness. The decreased production of natural lubrication can result in a dry or sticky feeling in the vaginal area. Women could also experience vaginal itching or irritation. The thinning and inflammation of vaginal tissues could lead to itching, discomfort, or a burning sensation. Vaginal atrophy can cause pain or discomfort during sexual activity, often described as a feeling of friction, soreness, or deep pain. The vaginal lining may produce less discharge, leading to a decrease in natural moisture. Some women with vaginal atrophy may experience urinary symptoms such as increased frequency, urgency, recurrent urinary tract infection, or urinary incontinence. Diagnosing vaginal atrophy typically involves a combination of several methods. The healthcare provider will inquire about the symptoms, menstrual history and reproductive history, any previous hormonal treatments, and any relevant medical conditions. A pelvic examination may be performed to assess the vaginal tissue, including its thickness, color, and moisture. Testing of the pH levels of the vagina can help differentiate between vaginal atrophy and other infections or conditions that may cause similar symptoms. In some cases, a vaginal swab or sample may be taken to rule out other infections or conditions that could contribute to the symptoms. The treatment of vaginal atrophy aims to alleviate symptoms and improve vaginal health. The most effective and commonly prescribed treatment for vaginal atrophy is local or systemic hormone therapy, such as estrogen therapy. Estrogen can be administered topically in the form of vaginal creams, tablets or rings, or systemically through oral medications or patches. These treatments help replenish estrogen levels, improve vaginal tissue health, and relieve symptoms. Over-the-counter vaginal moisturizers and lubricants can provide temporary relief from vaginal dryness and discomfort during sexual intercourse. They can be used regularly or as needed to maintain vaginal moisture and reduce friction. In some cases, healthcare providers may recommend the use of vaginal dilators to help stretch and expand the vaginal tissues. This can help alleviate pain during sexual intercourse and improve the elasticity of the vaginal walls. Certain lifestyle changes can complement medical treatments and help manage symptoms. This may include avoiding harsh soaps or douches, wearing breathable underwears, staying hydrated, and practicing regular sexual activity to promote blood flow to the vaginal areas. Women undergoing treatment for vaginal atrophy may require regular follow-up appointments to assess the response to treatment, adjust medication dosage if needed, and address any concerns or new symptoms that might arise. While vaginal atrophy cannot be entirely prevented, certain measures may help maintain vaginal health and delay the onset of symptoms. Regular sexual activity or stimulation can promote blood flow to the vaginal area and help maintain vaginal elasticity and lubrication. Using vaginal moisturizers and lubricants even before symptoms arise can help maintain vaginal moisture and prevent dryness. Vaginal atrophy can have emotional and psychological implications, particularly when it affects sexual function and intimacy. Seeking support from healthcare providers, counselors, or support groups can provide guidance, address concerns, and help cope with any emotional challenges. As we conclude this segment, it's important we understand that vaginal atrophy is a common condition that occurs due to decreased estrogen levels, particularly during menopause. Hence, understanding the causes, the symptoms, diagnosis and treatment options for vaginal atrophy is essential for managing symptoms, improving vaginal health, and maintaining sexual well-being. It's important to consult with a qualified healthcare personnel for a comprehensive evaluation, accurate diagnosis, and appropriate treatment.